Bird flu is emerging as one of the biggest public health risks right now on a global level. And virologists believe that India should continue to monitor flu viruses very closely. While there is no immediate cause for public alarm, the scientific community, researchers, and government must step up their efforts to boost the surveillance of virus strains which are in circulation right now. Bird flu is also known as avian flu or H5N1, and this virus is known to infect just birds. However, new findings highlight a growing concern that H5N1 bird flu strains are rapidly mutating and infecting a new host species. While the virus is generally found in wild birds and poses risk to poultry, its spreads to a new range of mammals may pave the way for new mutations that could increase its lethality. In 2024, the virus was detected in dairy cows for the first time. Scientists at the Texas Biomedical Research Institute have identified a strain of the bird flu virus in a Texas patient that carries up to 9 mutations. While it is not yet proven, but it is suspected that these genetic changes may enhance the virus' ability to cause disease, replicate in the brain, and increase its overall severity. This sparks concerns about the virus becoming deadlier. What is most concerning is that humans will have no prior exposure and immunity against this virus. We understand that the virus has no control over its mutations. So far, it has achieved changes in infecting other species like cow instead of just infecting birds. Hence, we need preparation if this virus achieves further mutations and starts infecting humans. The situation will become alarming if the virus starts infecting humans from humans. So far, 9 mutations have been spotted in the virus, and experts believe that these mutations are likely to be treated via approved antiviral drugs. But as I told you, humans will have no prior exposure to this virus, and for this, the trends need to be monitored very carefully at both domestic as well as global levels. Let's understand this from the country's top virologist, Dr. Soumitra Das.
Bird flu is a major concern at this stage, I agree. And particularly, so far it was restricted to birds and the chickens. Lately, it started spreading into mammals, including dairy cows. And very recently, there are reports that actually there was a transmission to human, and the virus isolated from the human patient showed there are 9 mutations. Now, one possibility is that such kind of mutations can increase the infectivity of the virus and even change the host range, and it can start infecting other species as well. So one has to be carefully monitor the sequence variations that are happening or the mutations that are appearing routinely. But the good thing is that so far the mutations didn't really cause any changes, so the efficacy of the FDA approved antivirals should be still effective. But the only thing is, as you know, the humans are not really pre-exposed to avian flu viruses, so and also the flu vaccines, the human flu vaccines may not be so effective against this particular virus, so one has to be alert, but nothing to be panicked, and then I think one has to be just careful and then avoid this kind of spread of this flu that is actually might be very difficult to distinguish between with the seasonal flu, but one has to be careful.